Hi everyone, this is Shalli Kumar again from OSCE Nurse Training Cambridge, and I'm experienced OSCE Nurse Trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. So welcome back to my YouTube channel with another NMC OSCE video for you. So if you like my channel, please press like and subscribe. Also share it with your friends who are also preparing for OSCE or maybe thinking to do OSCE in the future. Okay, so today's video, really important one. I'm going to cover what are the most common five mistakes people make in exam and end up failing and not getting their pass first time. Okay, so I am going to share that with you. Of course, I will tell you how to avoid those mistakes so you can pass your OSCE first time. Okay, so it's a really good one, so pay attention and watch it, and I'm hoping that this will really help you in your exam. So let's get started. So the first one, which is the most common fail, I know it's a very simple one, but it's most common fail in overall in OSCE. It could be to any station in OSCE, but this is a very common one. So the first one is correct identification, allergy check, and also taking consent. So I put it all together because normally when you do your ID check and allergy check, next thing is you always take consent. Okay, so I have kind of put it together. Now you may seem it's obvious because you explain to the patient that's what you're going to do, but you do need to do in a correct way. The ID check, the allergy status, and the reaction of the allergy, that's really important. You can't just ask for the allergy, you do definitely need to ask for the reaction. If you don't, it will be a fail. It's part of your marking criteria. And then we will talk about consent in a second, but let's talk about ID check. So ID check has to be in a correct way. I mean that you're asking the patient, not telling the patient what their name is, because you may have their documentation, you may have their name. No, you need to ask the patient for full name. If the patient is in hospital, you also need to see that it's correctly written on their name band, and it matches correct page of your documentation. So don't stay on the front of the document, because most of the time front of your documents just give you some instructions to carry out that station. Normally the ID details and allergy details are inside page. Okay, so if you stay on the front page, your examiner know that you're pretending, you're not doing ID check in real time, and that would be a fail, and that is a very, very, very common fail, a reason for fail in your OSCE. So you're going to ask the name, date of birth from your patient, look at that is correct on their name band and it's correct in your documentation. Now if the patient is in hospital, they will have a hospital number written on their ID band. Make sure you check that from their ID band. Patient will not know their ID number, hospital number, but it's written on their ID band, and check that against your document. Next thing is, if your patient is allergic to anything, they will be wearing red allergy band. So you need to ask directly what is the allergy, what is the reaction. You need to look that, check that against their red band, and then also check in your document that it is written correctly. Okay, so it's not only just checking with your eyes, it's verbalizing that you're doing it. Okay, so you constantly say that I'm checking it, my document, I'm looking at your name band, I'm looking at your allergy band. So you really need to make it obvious to the examiner that you have done it in a correct way. So that's really, really important. It's a very simple fail, but it's a very common and very frustrating fail as well. Okay, allergy status, I already told you that you need to check the reaction. If you just check the allergy, not check the reaction, it would be a critical fail. Next one is valid consent. Now consent can only be valid if he's informed. Okay, so, and also your patient has to directly say that they are okay with going ahead. So if you just say, here is my machine and I'm going to check your blood pressure, and then go ahead and check the blood pressure, now that's no consent, is it? So you're just saying, here it is, the thing, and I'm going to do it. Did you actually say to the patient, is it okay if I go ahead and do your vitals or check your blood pressure? So you really need to ask directly for the consent. Just saying what you're going to do is not consent. Okay, so stop, ask direct question. Is it first thing is explain what you're going to do, and then directly ask a direct question. Is it okay if I go ahead and do it? And when you hear the yes, then go ahead. Okay, so it's really, really important. Again, very frustrating fail, but it happens a lot in OSCE because we can sometimes assume because we have explained, we have taken consent, but that's not right. And your examiner will be looking for that direct question you ask in your patient or mannequin. Because if it's mannequin, then your examiner voice will be the mannequin's voice, okay? But you still need to ask the mannequin that question. Second on the slide. Now, second very, very, very big reason is the documentation. Now, documentation could be anything in your exam because it's lots and lots of different documents, but I am just saying the most obvious ones which people fail, okay? The most common ones which people fail are not doing the news chart, and if you're using news chart, then not using it correctly, not plotting everything on it correctly, or if you're using, for neuro scenario, if you're using the neurological observation chart, not completing that correctly, or your MAR chart. Again, lots of people fail on documenting in MAR chart. So I've just put documentation in one place, but these are the most common documents failed in exam. Is your vitals charting, and then is your obviously vitals, both news 2 chart or GCS chart or your MAR chart. They constantly keep coming up because people are not completing it correctly. So your documentation, the other thing is you need to make a priority because you have a very set limit of time, and if you have done the vitals, please plot them, okay? Make it priority, plot them, because if you just start doing other things, say you done the vitals but then you start talking to patient about their nursing needs, the time might just keep going and you might even not realize that you haven't plotted vitals or not completed your news chart yet. So please do that first and then talk to patient about their nursing needs, okay? So it has to become priority. Same for the medicine chart. If you given the drugs, they have confirmed they have taken it, you need to go ahead and sign that drug chart, okay? Don't get into conversation, any other conversation. Here is your call bell, I will come back in 30 minutes. All that can wait. Your signature is really important for the drugs given, or if you omitted a drug, you need to put a mission code and sign. So all that needs to be done in very timely manner and as a matter of priority. Any documentation you do have to be legible, okay? So lots of people can document things, but if they are not clear, their handwriting is not clear, examiner can't read it, then that's a fail as well. Another thing is dated and signed. So lots of documents in OSCE, like your news chart, your GCS chart, your MAR chart, they all ask for at some stage date and sign. So you really do need to make sure, if they're asking like your care plans, they need to be dated and signed. So all those things where they're asking you something, please put that date, put that sign. If they're only asking for sign, then sign. If they're asking you to put date, then put date in as well. So it's really, really important that you pay attention to the minor details on documentation, because there is no way you're going to pass the exam if your documentation is not perfect. I mean perfect. There is no room for error in that, and in our training we really, really work hard on getting your documentation absolutely perfect, because we do want you to pass first time, and we know it's a very big reason for fail in exam. Moving on to the third slide, drug administration. Now it's really important that whenever you're doing drug administration in your exam, it's a very, very, again, very common fail. People only think drug administration is the implementation station only. No, there are lots of clinical skills where you're giving drugs. IM, subcut, IV flush, oxygen, inhaler, suppository. So they're all drug administration station. So your drug safety principles apply to all stations, not just to implementation station, okay? So you really need to think from that point of view. If you are giving drugs, you need to make sure you have identified your patient correctly, and identified their ID status, identified their allergy status and reaction. That's really, really important. Simple things, but sometimes you do an implementation, you do remember, but then when you're giving in skills, when you're giving medication, sometimes you forget to do it, and it has to be done against your prescription. Whatever prescription you have in your hand, you have to do against your prescription, and the details will be on there. Another thing is the validity of the prescription. Never forget that you cannot give a drug in UK, or to be honest anywhere in the world, but especially, if we're talking about the UK nursing, that you cannot give a drug without a legible and valid prescription. So checking the legibility and validity of the prescription is really important. Not only just checking it with your eyes, verbalizing it. Okay, so verbalizing everything, the drug, the dose, the start date, end date, and anything like prescriber signature, bleep number, whatever is on your prescription need to be read correctly, and that's how you check your validity, because lots of people are failing implementation station because they are not reading everything in the drug chart for the prescription validity. They are only trying to read the drugs which are due at their time. They are not reading all the drug chart. Your marking criteria clearly say to read the full drug chart. Okay, so that's the other thing you need to remember. Checking validity, but checking validity for everything on the implementation station. And when it comes to your clinical skills, it's only just one drug, but you do need to check the validity for a prescription for the particular drug you're going to give in your clinical skill. Another drug checks, another thing is always when you're dispensing drugs, verbalize clearly the name of the drug, the dose, the expiry date, and also clearly how many tablets you're going to dispense, and dispense the correct dose. It's very common in exam for you to say I'm dispensing 2 tablets, or you work out is 2 tablets but you only still dispense 1. So you say, okay, my paracetamol is 500 in stock but prescribed dose is 1 gram. I'm gonna put 2 tablets, but in the end you only dispense 1. Don't ask me why. Must be the exam nerves. So just be very, very, very careful. Okay. Another thing is document for omitted and given drugs correctly. So you should know how to document in your mark chart correctly, and if you're doing clinical skills, whatever documentation you're given in clinical skill, then you document the given drug correctly as well, because that is part of your station. You can't just give IM injection and not document correctly. Okay, so it doesn't matter whether it's IV flush, IM, oxygen, whatever it is, make sure you know your documentation and make sure you have practiced it and make sure you can do it correctly. Okay, so that is becoming a very, very big fail, common fail in OSCE exam. Number 4, we are going into factual, relevant and evidence based. Okay, why do I put it there? Because again it's becoming a very common fail in OSCE, especially in your planning station, where you are choosing some nursing needs which are not relevant to your patient, okay, or your scenario. So whatever you choose has to be factual, has to be a fact. You can't write a pain care plan if your patient is not in any significant discomfort or pain. So, it has to be a fact for that patient. You cannot just make assumptions. Next thing is relevant to given scenario. Whatever nursing needs or whatever thing you choose to write your care plan has to be relevant to your scenario. So, and has to be a significant, important nursing need for your patient. Another thing is anything you verbalize, perform or write in OSCE must be best practice based on evidence. Okay, so that's why it's so important that you don't write anything which is not scientifically proven. Okay, so any interventions you write in your care plan or in assessment, any intervention you verbalize to your patient that you're going to do this, you're going to do this, you're going to do this for them, whatever you're saying, it has to be evidence based. Like say for example, I am talking about shortness of breath. I am saying to my patient, I'm going to sit you in upright position. So that's evidence based practice. I can't just say I'm gonna just give you a comfortable position, because comfortable means what? What's going to help with shortness of breath is the upright position, semi-followers, upright position. So you have to be specific and clear in what you're saying, and whatever interventions you do has to work as per the evidence-based practice, no homemade remedies. Okay, so that's what you need to do. and be clear what you're trying to say, or trying to write in your care plans, or trying to say to your patient in assessment station or any other stations. Okay, next one is time management. Now that's obvious one, but again very common fail, because I think it depends on where you take training, or what kind of training you take, or if you're preparing yourself, how effective is your revision and preparation technique. So how you manage time, I give you few things for exam, but then again it starts before exam, this time management. Remember to look at the timer. So timer is very clear in front of you in the exam center, so you do need to make sure you keep an eye on the timer and not completely forget about it. Every now and then just check that you are okay with time, because if you're not okay, then you might have to just quicken up. And prioritize things. Be prepared to multitask. So don't just stand there cleaning hands every time 7 steps. You have to do 7 steps, but it should be so automatically, you should be so much used to doing it that you can do other things with it. So I could be cleaning my hands and taking consent. I could be cleaning my hands and giving side effects of the medication. I could be cleaning my hands and at the same time talking to my patient about something else which is important. So I might have to multitask. Another thing is, do not repeat pre-checks. If your examiner is saying, listen to the briefing, if they say trolley trays are clean, ID check is complete, allergy check is complete, because they do say that for a lot of clinical scales where you are not giving medication. If you're giving medication, you have to do your ID check, allergy check. If you're not, then they're telling you that these pre-checks are done. So please don't repeat it, because otherwise you will never finish the station in time set. Practice with a timer, including written skills. Now that's where your training or preparation or revision techniques comes in place, because if you were taking training, which is really good, they're going to make you again and again say, let's do it under time conditions. Okay, let's see how you do in these 15 minutes, let's see how you do in 20 minutes, and they are going to make you do all the stations. So when you do your practice or revision, make sure you're putting timers on, so you are confident that in exam you can do it in the time limit. And don't only just put timers on for hands-on station, even for written station you need to revise and practice your planning station under time condition. You need to practice your evidence-based practice, professional value topics under time conditions, because in the exam you have to do under time. And there are lots of written clinical skills now, like pressure area, fluid balance, everything. There are loads of written clinical skills which need to be practiced under time condition, and that should be built in your training. Or if you're doing it yourself, then you should time yourself. Okay, so I hope these things help you. Just really want you to get out these most common fails right in the beginning of the year. So we want to start, obviously January is gone, but yes, I want you to make sure that you keep these things in mind and don't make these mistakes. So hopefully you like the video. If you do, please press the like and subscribe, share it with your friend, go and check our Google reviews. You can visit on OSCEnursetraining.com or email us on OSCEnursetraining@outlook.com. We give both online, face-to-face, or hybrid, both combination of online and face-to-face as well. So whatever suits you, give us a call, and I will see you next time with another video. Bye for now.